Okay, I want to welcome you to the University of Maryland Dental Hygiene Program Open House. This is an informational session, and if you have any questions or concerns, you can always email me, and I'll give you my email at the end of the lecture. But welcome to the University of Maryland. The founders of our school were Drs. Hayden and Harris. Drs. Hayden and Harris were physicians over at the University of Maryland Medical School. Felt like there needed to be something geared toward the oral cavity. So in 1840, they created the Baltimore College of Dental Surgery, which was the first dental school in the entire world. Okay. Around 1913, dental hygiene was established, and that was in Connecticut, and there was a Dr. Alfred Phones, who had a dental assistant, Irene Newman, who he felt that needed to go into the community and do some public health and educate children in the city of Bridgeport to increase their oral health. Our school came along in 1970, so it's been here since 1970. It's the only Bachelor of Science dental hygiene program in the state of Maryland. We share our campus with the University Hospital, the medical school, nursing school, law school, pharmacy, social work. So we're part of a professional campus. We're located in the heart of downtown Baltimore, right near the Inner Harbor, and close contact with Camden Yards and Ravens Stadium. So here's the mission statement of the University of Maryland School of Dentistry: to improve the quality of life in Maryland through education, research, service related to health, with special emphasis on improving dental, oral, craniofacial health through comprehensive education, research, and service programs. And that's what we do. Everything that we do with our students is research, it's education, and service. So what is dental hygiene? Well, it's a study of preventive oral health care. It's the preventive arm of dentistry. Okay? We manage behaviors to prevent oral disease, and we promote oral health. So a little bit of our past. In the 1800s, as I said, the first dental college was 1840, and that was here. But in the 1800s, pioneers recognized the benefit of a clean oral cavity. Prevention was a very hot topic. And by 1900, there was value in the removal of plaque from teeth. One of the dentists, Dr. David Smith, said that recall appointments improved oral health and overall health. Wow, that was in 1900. And what do you hear now? Overall health is impacted by oral health. There's an oral systemic link. So we're still saying the same information from over 100 years ago. Dr. Parmalee recommended the regular use of waxed floss, and Dr. Ryan was vocal in promoting home care and home care education for his patients. So they created something called the specialized lady, and it was only a lady, and this was a dental hygienist, okay? It's a new specialist to help patients obtain optimum health, and these ladies may be employed by dentists or may practice at parlors of their own or at the homes of patients, just as physicians insist upon the services of the trained nurse. Okay, the dentist is in need of this subspecialty. So that's how a dental hygienist idea came along. In 1910, they did something I believe this was in Ohio, in Marion School experiment to prevent disease in children. And again, if the overall health and health of the dental oral cavity was related again. In the meantime, Dr. Phones wished that all children of Bridgeport had access to care. Now, Dr. Phones' program, this is his dental hygiene program he first created. It was $20 and it lasted 6 weeks. Okay? The program lasted 3 years, and then Dr. Phones advocated a more formal program, created an associate degree program, and that's at the University of Bridgeport, which is still in existence now. So Connecticut, Massachusetts, and New York opened schools around 1916. The Phones School of Dental Hygiene, the Forsyth School of Dental Hygiene, which is in Massachusetts, and the New York School of Dental Hygiene, which is Columbia. So Phones' original program documented success in elementary schools in the Bridgeport area. So more and more schools opened. In 1927, the American Dental Hygienists Association was established. And here's the quote for membership: what you get out of it will depend on what you put in. If you stay on the outside edge, lost in the dimness of inconspicuousness, your returns on investments will be slim. But if you come forward where you may be seen, then you will be amplified, repaid in more efficiency, alertness, and contentment. So the 20s and 30s, as I said, the American Dental Hygienists Association was established, more schools opened, and the public began practicing home care more regularly. Nylon toothbrushes in the 1930s were created. Instead of, they used to be pig's bristles to brush your teeth, and then access to affordable dental floss. And a Bass technique, which is a toothbrushing technique created by Dr. Charles Bass, became very popular. The 40s and 50s, the American Dental Association created CODA, which is the Commission on Dental Accreditation. So there were curriculum and standards for dental hygiene programs. Phones reopened formally in 1947, and the first master's program at Columbia in 1953 became available for dental hygiene. Sigma Phi Alpha, which is the Dental Hygiene Honor Society, was created in 1959. The 1940s brought about the fluoridation pilot studies, and fluoride became standard. And the 50s, fluoride treatments were the standard of care, which they still are today. In the 60s and 70s, 1962, they established a national board exam. And to be a dental hygienist, you must not only be licensed in your state. To be licensed, you have to go to an accredited school and graduate. You have to take a clinical board, which with a real patient, and you have to take a written board. And if you pass all that, then you may sit for licensure in your state. Then in the 60s and 70s, the first electric toothbrush came along. In 1963, liability insurance was established for dental hygiene professionals. In 1967, the American Dental Hygienists recommended continuing education, meaning that after you graduate, you should still be taking courses to keep up with the technology. And in the state of Maryland, you must take 30 credits every 2 years when you renew your license of continuing education. Sealants became accepted, that is preventive treatment for children. And in the 70s, new auxiliaries are created in medicine. There was a holistic approach in the 70s, and government funding increased allied health programs and community colleges. The first dental hygienist was appointed to the State Board of Dental Examiners, and that was in Maryland. And then pantsuits, hygienists began wearing pantsuits instead of dresses. In the 80s and 90s, the Dental Hygiene RDH, Registered Dental Hygienist Magazine, and Access Magazine was established. OSHA mandated changes in sterilization, personal protective equipment, aesthetic dentistry became very big, computers and digital radiographs. Today, the big word today is access to care, scope of practice, establishing a dental home, interprofessional education, dual degrees, baccalaureate as the entry level to the dental hygiene profession. So as I stated before, prevention and dental hygienists, it's the core of who we are. Prevention is our core. We play a very important role in development and implementation of prevention programs. Here's our school. We have juniors and seniors in this program. We also have degree completion students in our program. Those are dental hygienists who earn an associate degree and now want to come back for their bachelor's degree. Our students do numerous things in this school while they're here. They're busy. They're very busy from the moment they come to the moment they graduate. But they have so many great experiences to get them to be leaders in their profession. Okay, students participate in interprofessional programs. That means that they not only are here in the dental school, they also work with dental students. They work with medical students, nursing students, law students, social work, pharmacy students, to learn and take an interprofessional approach to healthcare. So we offer a Bachelor of Science program. It's a full-time program. Every student comes in as a junior. They do their first 2 years prerequisite coursework at a college or university of their choice. That's an accredited, regionally accredited program. And then if accepted, they spend the last 2 years, the junior and senior year, here on this campus. So why a baccalaureate degree? There are many programs in the state, and we are the only bachelor's degree. But here at the University of Maryland, we are on a campus of professionals. So you're not only going to school with just dental hygiene students, you're going to school with, again, medical students, dental students, law students, social work, nursing, pharmacy. You're meeting all different kind of healthcare providers. And that's a new system of healthcare delivery, interprofessional care. There's also change in oral disease patterns. It's just an aging population that keeps your teeth longer. There's a more informed health conscious public, And we want you to become critical thinkers. We want you to think outside the box and think critically, and that is a well-rounded four-year university baccalaureate degree. So advantages of being a hygienist, pretty satisfying. It's a team approach, team players. We're motivators and communicators. We're patient-oriented. There's prestige. We're the only other clinician or healthcare provider in a dental practice that brings money into the practice. Security, and you can be creative with how you educate and treat your patients. Here's the opportunities. All these opportunities and career opportunities for hygienists: private practice, education, management, research, public health, institutional practices, consulting, sales, insurance, law, marketing, hospital practice. So the demand for dental hygiene care is stimulated by the population growth and greater retention of natural teeth by larger numbers of middle-aged and elderly people. Of course, the baby boomer generation, they're all keeping their teeth, and they're going to need care. So you're going to need care from age 1 to 99 plus. In some states, dental hygienists are mid-care providers in some states. That's like a nurse practitioner. And we're answering the call to access to care for everyone. The benefits of obtaining a baccalaureate degree: there's greater critical thinking skills. You become an independent thinker. You're at baccalaureate degree status and pathway to graduate education. So again, besides the dentist, hygienists are the only other licensed healthcare professionals in the dental profession. Okay, there's stringent accreditation guidelines, national boards, state licensure. And here's the roles of a dental hygienist from the American Dental Hygienists Association. You can see in the middle the hygienist, and then surrounding the hygienist is always a public health approach. Be it a researcher, educator, clinician, advocate, administrator, they're always going a public health approach way. They're integral. We're integral part of the dental team. Okay, it's the core of our practice. And what do? We screen patients. We review health history. We're health advocates. We examine the mouth and scale teeth, apply preventive agents, administer anesthesia, nitrous oxide. We counsel patients regarding nutrition and good oral hygiene. And we provide educational, preventive treatment and services for patients of all ages and medical backgrounds. So every clinical service is regulated by each state law, but they can include evaluating and monitoring medical and oral health histories, since many systemic diseases have oral manifestations. A lot of times you'll find disease in the mouth first and realize the patient's got something else going on. Okay, we identify oral systemic health problems such as cavities, oral cancer, high blood pressure. We examine the head and neck as well as the oral cavity. So we're not just looking at your teeth, we're looking at everything. So here you see a picture that there's skin cancer on the patient. We're doing an oral cancer technique. We're making sure that we take that tongue and take a look at the back of it. And then you'll see other things in dentistry: decay, cancer, periodontal disease. We expose, develop, and interpret x-rays. We do all these services also. Our faculty is unbelievable. We have an amazing, dedicated faculty in this program. So we design, implement, and evaluate educational, school, and community programs. We participate in research and public health projects. We perform administrative and managerial functions, and we can work in sales and consulting. So how do we get there? If you want to come to the University of Maryland, how do I do it? Well, it's 57 credits of pre-professional courses. That's the Phase 1 prerequisite coursework. Again, done at an accredited, regionally accredited university or college of your choice. And then when you come here to this program, you do about 63 credits of professional courses. That's the Phase 2, and that's done here at the university. So educational prep, you should be taking, if you're in high school, courses in math, chemistry, biology for college prep. Dental hygiene education is a minimum of 2 years of college. However, most are 3 years in length to achieve an associate's degree. So why not get your bachelor's degree? If those programs are going to take you a little over 3 years to get an associate, get your bachelor's degree. Okay, it's 4 years of college, and we offer the only bachelor's in the state. So students complete 57 credits of pre-professional coursework. 24 of those are in specified science courses, and 33 are in specified non-science courses. Okay, here's the prerequisites. The science courses are anatomy, physiology 1 and 2, biology, chemistry, microbiology, and organic chemistry. They're all 4-credit classes, meaning they have a lab. Here's the non-science courses. Okay, and the total is 57 credits. So completion of the phase 1 doesn't guarantee automatically that you're going to be into the program. Okay? This is the applicant should maintain a minimum grade point of 3.0 on a 4.0 scale. If you look at the entering class of 2015, their GPA was 3.5. So you can go to our website, which is dental.umaryland.edu, and you click under dental hygiene or click under application or admissions, and you'll find all the information. Okay, so we look at college GPA, overall and science, completeness of an application, academic college transcript history, knowledge and interest in the profession, why do you want to be a hygienist, written and communication skills, letters of recommendation. You need 2 letters of recommendation, one from a dentist or hygienist and one from one of the science professors. I also tell students they can have a 3rd if they want to from an employer, and that's always a great letter of recommendation to have. So what's the quality of your personal statement? You have to write a personal statement. What's it look like? How does it read? You have to shadow minimum 8 hours a dental hygienist, and you have to document that and send that in with your application. It's a very competitive admissions process, and there is an interview, but that's at the discretion of the admissions committee. So by the end of the fall semester, prior to the year you want to come into the program, okay, so let's say that you want to come to the program next August, okay? By the end of fall semester of this coming year, you must have 16 to 20 of the 24 science credits complete, and by the end of the spring semester, you have to have every single course done. So you can't carry any work over into the summer if you wanted to get into the August program. We always take students once a year. They all start in August. Say phase 2, this is the courses that students take while they're here in phase 2. Okay, phase 2 senior year. It's about 63 total credits for phase 2. So that's about 120 credits. That equals a Bachelor of Science degree. Students while they're here do a lot of different activities. They may be going out to programs. They may be here at the Dental Museum educating children that come in to the museum, talking about careers in dental hygiene and dentistry. We also have what we call a Bachelor of Science in Dental Hygiene to Masters in Public Health accelerated program. So for here at the school, if a student comes in as a junior and they're interested in going to graduate school, they can get admitted conditionally into the Masters of Public Health program right on this campus. And they can be in an accelerated program, meaning they take 2 graduate courses while they're still in the undergraduate program, which count for both the bachelor's degree and the graduate degree. And when they graduate in May from our program, they're automatically in the graduate program. Okay, so the first year of the dental hygiene program, they decide, I want to go to the accelerated program. I want to apply to the Masters in Public Health. They may be conditionally accepted if they meet criteria of a 3.0 average. And they take 2 grad courses instead of undergrad courses. They have to take the graduate record exam in December of their senior year. If a 3.0 and 50% higher grade on the GRE, they're fully accepted into the program. So the courses count for both the bachelor's and the master's program. So what can I do with a Master's of Public Health? Well, you could be an administrator of public health programs. You can initiate research and be able to be the primary investigator, gain skills beyond clinical practice, and go above and beyond. So if one wants to teach or they want to go into other things besides clinical practice, they may consider the Masters of Public Health, which is right here on campus. Okay, students do anesthesia here and nitrous oxide. They practice on each other first before they give it to real patients, and that even with everything that you learn, you practice on each other first. So our accreditation, an accredited Bachelor of Science program, requires an average of 3,073 clock hours of curriculum, and that includes 607 clock hours of supervised clinical dental hygiene instruction. Here's our grading system. We use A, B, and C. We don't use anything beyond that. If a student gets lower than a C, that's an automatic F. We're taught by dentists, we are taught by hygienists, we are taught by nurses. So there's all different people that are involved in our education. It's the only baccalaureate program in the state of Maryland. It's housed right here in our dental school, and it's a very state-of-the-art facility. Comprehensive care is delivered to the public. Dental students and dental hygiene students provide care under supervision of licensed dentists and hygienists. We have amazing, outstanding faculty and very caring faculty. The ratio is about 5 to 1, okay? So if you're in clinic, you're going to be covered by 1 dental hygiene faculty, and there'll be maybe 4 or 5 of you. Classes are hybrid online learning, so some classes are live, and some classes might be online. So for one lecture, I might have the students in class live, and maybe the next week I might just do it online. So there's hybrid, okay? But this is a full-time program. It's very rigorous. Students are not only doing coursework, they're in clinic, they're managing patient care, so they're very busy. We use Blackboard extensively, and Blackboard is an online interactive website, and then we use MediaSite, which is where you're watching me right now. That's called MediaSite. Juniors have clinic 3 times a week, and seniors have clinic 4 times a week. There are labs, radiology, methods and materials labs, and their simulation lab. The simulation lab is very state-of-the-art. Students use that in their first year when they're learning the instruments. They work on the simulator head first, then they work on each other. Okay, here's a close-up of the simulator lab. You can see that she's using her instruments on the head. And that's another view of our simulation lab. Clinic blocks, students are not always in the dental hygiene block. They may be in periodontics, they might be in pedodontics, they might be in orthodontics. So that they get to work with different aspects in dentistry and become comfortable with all different types of patients. We have a special patient clinic or special needs patients. We have a plus clinic, which is HIV patients. So students are exposed to all different patients. Service learning is the mission of the Baltimore College of Dental Surgery, University of Maryland School of Dentistry. That's community outreach. It is a course in the fall and spring of their senior year. They are going out to community. They are access to care, all different populations, and it does require travel. So service learning students, they go into the community to provide access to care for all. Some service sites include Sealant Saturday. We always have a Sealant Saturday where we place free sealants on children. Special Olympics, the Veterans Hospital, Kernan Hospital, numerous health departments. The students go out and they may be in different settings. They may be providing care to patients, or they might be doing some education. So here's a student's actual quote from her. She's so excited she made a difference. I hope to go back in the future. It's a great experience. These kinds of results make me feel so great about doing community service learning. It's great to hear positive feedback. So potential salary, it's the salary and other benefits depend on the responsibilities, geographic location, education, and other factors. They earn equal salaries equal to healthcare personnel with similar training. Dental hygiene in Maryland and salary, you can look at the United States and then you look at salary in Maryland. And the trend is that there's going to be more job openings in the future. They're going to need more dental hygienists in different settings. As access to care and scope of practice issues change and hygienists can work in different settings, there'll be more areas for dental hygienists, more need. Okay, so you can see the wages in Maryland versus U.S. Okay, Maryland is red. So we create our lifelong learners. We create an education is for a profession. It's not just education, it's an education for a profession. We have excellent mentors and faculty, an excellent learning environment on the professional campus, and finding a network of professionals to practice with. So we've been educating professionals for over 40 years. We're very proud of what we do at this school, and we'd love for you to come and have a visit and apply to our program and become part of our family. So if you want more information, you can always talk to a hygienist. Okay, you can arrange a visit to a dental office, observe a hygienist at work. Remember, this is required for us. We require at least 8 hours of shadowing. You can go to our website. You can contact your national, state, or local dental hygiene association. Maryland's is mymdha.com, or the American Dental Hygienists Association is adha.org. Okay, here's the American Dental Hygienists Association. You can always contact me. I'm Manski at umaryland.edu. I'm the director of the dental hygiene program. Very proud of our graduates and very proud of our alumni and our current students. So I want to thank you for your time and visiting the University of Maryland School of Dentistry Dental Hygiene program. Thank you.